We do want to talk about some COVID cases here in Ohio. The Ohio Department of Health reporting 11,000 new cases just this week. That's above our 3-week average of about 9,800. Hospitalizations, they are also up. 422 reported this week. That's up from 396 the week before. Now, it isn't only those COVID numbers that are ticking up. We're entering the season of sickness, as you know, sickness for everyone here. So now is the time to protect yourself in any way that you can. Senior health correspondent Monica Robbins has some news that we need to know tonight. Monica?
Hi, Christy. Yeah, I'm here to tell you what I've been telling you for days. We're in cold, flu, and COVID season. Experts say if you haven't received your COVID booster or flu shot just yet, now is definitely the time to do so. I know most of us are just so over COVID, but unfortunately, it is not done with us yet. Ohio hit a dark milestone this month by reaching 40,000 deaths, and the Ohio Department of Health says about a dozen people die from COVID-related illness each day in Ohio, the median age 77. Another concern are these new variants popping up I've been telling you about. The good news, though, most of us have built a strong B and T cell immunity thanks to COVID infections and the vaccines, and that may be what's needed to help fight off these new variants.
And this may mean these variants will be able to make more of us sick, even though we may have been vaccinated and/or had previous illness. But there is, as of yet, no indication that these variants can break through our B and T cell immunity to cause severe disease. Vaccinations and boosters are a very effective way to build that highly protective B and T cell immunity.
Now, there's also good reason to keep those at-home COVID tests handy, because if you test positive, you can call your healthcare provider and potentially get an antiviral treatment like Paxlovid if you are at risk for more severe disease. Now, it must be taken within 5 days of symptom onset. And of course, the federal government not giving out those free tests anymore, but you may be able to find free tests at libraries, health departments, or community centers, or keep in mind, most insurance still covers them if you have to buy them in the store. Christy?
Okay, well, that's good to know. Talk to us about monkeypox. That outbreak is something that a lot of people were really concerned about at one point. Is it something that we still need to be thinking about?
Yeah, we haven't heard about monkeypox in a while, but as of today, we have 314 cases in Ohio. That includes 33 hospitalizations and 1 death. Now, 95% of these cases are in men. Cuyahoga County has the highest number of cases in the state at 147, and more than 2,300 people in Cuyahoga County have already started their vaccination. That's almost 50% of the total vaccine recipients in the state. And there is some good news on the monkeypox front, too.
We are now on a downward slope in terms of case numbers, et cetera. Now, I am quick to say that we are not done, and I don't want people to think we are out of the woods, but I think that we can look at the interventions that are currently underway and feel very confident that they are working.
Now, there is a concern because this virus really hasn't been studied thoroughly for decades, and some worry that we just don't know if there's a chance of long-term health consequences in those who've been infected. So scarring from blisters, that's a likely effect. However, some studies, and most of them are really rather recent, indicate there could be cases of blindness and urologic problems ahead for some of these patients. But really, it's still too early to tell, and the CDC is going to be looking for evidence of whether monkeypox could have those after effects like we've seen with long COVID, Christy.
I hope not for these people, Monica. Thank you so much. Sure. Good information that we need to know. Also, I want to tell you from the Ohio Department of Health, they're hosting monkeypox vaccine clinics this month. For instance, on Wednesday from 9 a.m. to 4 p.m., monkeypox vaccines will be available at the J. Glenn Smith Health Center, that's on St. Clair Avenue, and McCafferty Health Center on Lorraine Avenue. Locations, by the way, are offering first and second doses to all of you who are eligible.